Good morning, everybody. Many thanks, Pamela, for inviting me here today to address this food reformulation event this morning. My name is Curran. I'm the policy lead on obesity in the Health and Wellbeing programme in the Department of Health. And I've taken up that role recently enough, but it's a real honour to be here today to speak to you, to give you a little bit of I suppose, policy context in terms of what's happening in relation to overweight and obesity policy in Ireland. So I'd like to start actually with a story. Healthy Ireland was contacted last week by a publishing house looking to once again use the food pyramid developed by the Department of Health in the next edition of its Social, Personal and Health Education, or SPHE, textbook for first-year students in secondary school. I have a son in first year, so I took out his copy of the current edition and turned to the healthy eating section. Lots of excellent information for first years on what is in food, the foods they should be eating in line with the food pyramid, what they can do to eat a healthier diet, and a section on how to read food labels and look out for foods that are lower in calories, saturated fat, salt and sugar. All very sound advice. But what struck me was it was quite focused on putting the onus on 13 and 14-year-olds to adopt healthier eating. While looking at this material, I went into the kitchen to make a cup of tea, and I caught Donal O'Shea, our HSE clinical lead on obesity, on air, talking about Christmas confectionery. A particular piece of information from Donal stood out, that selection boxes are not only cheaper to buy than the individual bars that they contain, but they are about 1,000 calories per medium-sized selection box, a significant proportion of the recommended calorie intake for young teenagers. For those of you who have teenagers or younger children in the audience, how many selection boxes do you think they might be getting in the next 4 weeks? I know that my 3 teenage sons will get a few or more than a few. So why am I telling this story? I think it's to highlight the importance that we need to take a multifaceted approach to tackling what is one of the greatest challenges of today, the greatest health challenges of today, the overweight and obesity challenge. And Pamela has alluded to it already. The health consequences of living with obesity are well known, with increased risk of cardiovascular disease, chronic respiratory infection, diabetes and cancer, to name but a few. And living with obesity has also been linked to poorer outcomes in relation to COVID-19. The figures speak for themselves, and Pamela has mentioned some of them already. But I've taken a few figures here from the WHO's European Regional Obesity Report, which was published earlier this year. The chart there on the left shows a trajectory. Now, it's not possible to see the exact figures, but I think this shows a trajectory from 1975 up until 2016. The top lines being overweight for men and women and for the total population, overweight including obesity, and the bottom line being obesity. And I think they speak for themselves. They've been increasing steadily since 1975. In 2016, across the European region, just under 59% of adults and 8% of children under 5 were considered overweight or obese. Nearly 1/4 of adults in the European region were living with obesity. Ireland ranked 11th out of 51 countries, and this is not a top ranking that we want to have, really. This is far too high, and with rates that were over the European region averages. And this is based on 2016 data. As Pamela has mentioned, the Healthy Ireland survey in 2021 indicated that adults felt that they had put on approximately 29%. 29% of adults reporting that they had gained weight during COVID. The next Healthy Ireland survey for 2022 is due for release next Monday by Healthy Ireland, but we're not really expecting any pleasant surprises in the findings regarding weight management. So just to take you on to the policy context. The WHO report also highlights that no country in the European region is on track to halt the rise in obesity by the target date of 2025. The report states, and I quote, obesity is complex with multifaceted determinants and health consequences, which means that no single intervention can halt the rise of the growing epidemic. Educating our young people obviously is extremely important, but it alone won't work. We live in an obesogenic environment where multiple initiatives are needed to combat this epidemic. So what are we doing about it? Ireland has a comprehensive whole-of-government strategy in place to address obesity and overweight. It was published in 2016, A Healthy Weight for Ireland, The Obesity Policy and Action Plan, or OPAP, recognises, like the WHO, the complex nature of obesity and that there isn't one simple solution and that every sector of society needs to play its part. The OPAP has a 10-step programme to tackle obesity. These 10 steps set out the actions required across a range of government departments and agencies and different sectors and chart a course for reducing the overall burden for individuals, their families and the health system. In addition, the Healthy Ireland Strategic Action Plan, a Government of Ireland initiative, contains a number of specific deliverables relating to obesity and nutrition, including food reformulation. This isn't a challenge that is being addressed only by the Department of Health. We work across government with many different departments, such as the Department of Education, Department of Children, Department of Social Protection, and of course the Department of Agriculture, Food and the Marine. We work with state agencies and all island bodies that are key stakeholders in driving this agenda, not least FSAI and Teagasc Care Today. We work with external stakeholders too to progress different initiatives that will help our citizens to lead healthier lives and reduce the incidence of obesity and many other chronic diseases that are linked to obesity. So some of the initiatives underway in the Department of Health are shown in this slide. For today, I just want to highlight a small number of these. The first one there is the Healthy Weight campaign. This is a recent campaign that we ran for 10 weeks to the middle of November, which is targeted at 24 to 35-year-olds through social media. It aims to change the conversation that we have around overweight and obesity being solely about eating less and moving more. It introduces factors such as stress and sleep into the mix, and also that it is not just about personal responsibility that is going to change things for you. This age cohort was chosen because we witness significant weight gain as we go through our 20s and into our 30s. As people's lifestyles change, moving out of team sports into your first car, focusing on your career, responsibility of owning a home or having children with less time for physical activity. Results so far show there's been significant engagement across this age cohort on TikTok and other social media platforms. They indicate that they want to change. They don't want for their weight to be increasing, and they want different options, including healthier food choices in order to be able to manage their weight. The campaign is the first of its type and will provide a lot of insight into the impact of targeting a particular age cohort through social media and the social listening that we gain from this campaign. We know that obesity is more prevalent in lower socioeconomic areas. The Sláinte Healthy Communities programme, an initiative which runs through our partners in the HSE and local authorities, has dedicated funding for initiatives such as the Healthy Food Made Easy programme. 19 community food and nutrition officers have been recruited to work with families in lower socioeconomic areas to provide education around healthy nutrition, even including bringing families, in particular the mothers of single-parent families, into kitchens to help them with preparing healthy meals. Front-of-pack labelling is an issue that's currently being addressed at an EU level, and developments in this area will no doubt have an impact on food producers such as yourselves, retailers, and on the consumer. The ESRI Behavioural Science Unit just carried out a piece of research for the department on assessing the impact of Nutri-Score labelling and product availability on consumer choice. And their findings were that the Nutri-Score front-of-pack labelling did indeed have a modest impact on consumer choice. And over time, this could make a significant health impact. These findings bode well for the work that the Food Reformulation Task Force is doing. It is clear that there is consumer support, and as Pamela has mentioned as well in their own survey, that consumers really, really want to have healthier options, healthier food options. The demand is there. So this brings me to today's subject. A significant milestone in the OPAP delivery was the publication of the Reformulation Roadmap in December 2021. Change in the food environment is one of the most important policy actions for helping prevent overweight and obesity. The targets and timelines to work together to reduce calories, fats, salts and sugar in many everyday foods are very clear. The Department of Health was delighted to be able to partner with the FSAI in setting up the dedicated task force, which has ring-fence funding and a clear mandate. We appreciate the voluntary nature of this initiative, but we also have to remind you that if the targets aren't being met through a voluntary pathway, we will need to consider introducing legislation further down the line. However, if we achieve these targets set out in the roadmap by 2025, this could be a real game changer in making a significant difference to the health and well-being of everyone, in particular to our children. Consumers want to eat more healthily while also continuing to enjoy their favourite foods, and food reformulation makes this a real possibility. And this is why I'm very excited to be here today speaking to you, but more importantly, to have the opportunity to listen to you. Many of you are already reformulating your products and have many years of experience in this. Sharing your experience and your insights here today will be invaluable to those who wish to start on this path or those who may be struggling with the task at hand. Reformulation on its own will not address the obesity issue, but we recognise that when combined with the other many areas of work being carried out, the result is what the WHO describe as outcomes that are better than the sum of their parts, and taken together will go a long way towards tackling obesity. I'd like to thank the FSAI and Teagasc for hosting this event. I look forward over the coming months and years to witnessing the progress of the task force, working collaboratively with industry. And I also look forward to feeling less guilty tucking into a selection box in Christmases to come. Thank you very much for your time.